Trepanation, unearthing the secrets of ancient skull surgery. Imagine a world without modern medicine, where the only way to alleviate suffering involved drilling a hole into the skull. This unsettling practice, known as trepanation, is far from a relic of the past. Join us on a journey through time as we explore the ancient art of trepanation, uncovering its mysteries and revealing its surprising legacy. We'll delve into the minds of those who dared to tamper with the most complex organ in the human body. Our journey begins with the Edwin Smith Papyrus, a remarkable document considered the world's oldest surgical text. Dating back to ancient Egypt, this papyrus offers a unique glimpse into early medical knowledge. Within its fragile pages, the papyrus details various brain injuries, including fractures, dislocations, and lacerations. It reveals an understanding of the brain that is surprisingly sophisticated for its time. The papyrus showcases the ancient Egyptians' ability to assess and treat head trauma using rudimentary tools, likely made of flint or copper. These tools, though primitive, were wielded with a purpose. What's truly remarkable are the insightful prognoses and symptom descriptions found within the papyrus. These observations demonstrate a keen understanding of the relationship between brain injuries and their effects on the body. The story of trepanation extends far beyond ancient Egypt. Trepan skulls have been discovered across the globe, from the Americas to Europe and beyond. These skulls offer invaluable insights to medical historians and pathologists, providing tangible evidence of this ancient surgical practice. Each skull tells a story of pain, survival, and the enduring human quest for healing. Careful analysis of the trepanation sites often reveals signs of healing, indicating that many patients survived the procedure. This suggests that trepanation was not always a death sentence. The intentions behind trepanation remain a subject of debate. Was it performed to relieve pain, release pressure, or treat mental illness? The answers may lie within the bones themselves. Imagine the skill and precision required to perform trepanation without the benefit of modern anesthesia or sterilization. Ancient surgeons relied on their knowledge of anatomy and their steady hands. Comparing ancient methods to modern trepanation procedures highlights the dramatic advancements in medical technology. Today, we have access to sophisticated tools and techniques that were unimaginable in the past. Advancements in anesthesia have revolutionized surgery, allowing patients to undergo procedures without experiencing excruciating pain. Sterilization techniques have also significantly reduced the risk of infection. The crude tools of the past stand in stark contrast to the sophisticated instruments used in modern neurosurgery. This evolution reflects our ever-growing understanding of the human body. Medical historians shed light on the cultural and social contexts surrounding trepanation. They explore the beliefs and practices that may have influenced its use in different societies. Pathologists analyze the trepan skulls, searching for clues about the patient's health and the surgeon's techniques. Their expertise helps us understand the potential risks and benefits of the procedure. The motivations behind trepanation were likely complex and varied. Religious beliefs, spiritual practices, trauma treatment, and neurological disorders may have all played a role. Evidence of healing around the trepanation sites provides valuable information about survival rates and the body's ability to recover from such a drastic intervention. This evidence challenges our assumptions about ancient medical capabilities. Was trepanation effective in certain contexts? Experts offer insights into the potential benefits of the procedure, considering the limited medical knowledge of the time. Trepanation, an ancient and unsettling surgical practice, offers a unique window into the history of medicine. It forces us to confront our own mortality and the enduring human fascination with the brain. The ingenuity and resilience of early medical practitioners are truly remarkable. They dared to explore the unknown, pushing the boundaries of what was possible with the limited resources available to them. The long and complex history of medicine is a testament to our ongoing quest to understand the human body. Trepanation serves as a reminder of how far we have come and how much we still have to learn. The human skull, a fortress protecting the very essence of our being, has been breached for millennia. Trepanation, the act of surgically opening the skull, stands as one of the oldest surgical procedures known to humankind. This is not merely a macabre curiosity, but a window into the minds of our ancestors, their understanding of the body, and their desperate attempts to alleviate suffering. Join us as we delve into the history of trepanation. Across continents, from the frozen Andes to the sun-baked plains of Africa, evidence of trepanation has been unearthed. Skulls bearing the telltale signs of surgical intervention offer a tangible link to the past. These discoveries are not isolated incidents. They represent a widespread practice, suggesting that trepanation was a common, albeit risky, procedure in many ancient cultures. The presence of healed bone around the trepanned openings is particularly significant. It indicates that the individuals survived the surgery, sometimes for years afterward. The tools used for trepanation varied depending on the culture and the available resources. Flint blades, obsidian knives, and even sharpened stones were employed to penetrate the skull. The reasons behind trepanation are shrouded in mystery, but archaeological and anthropological evidence offers some clues. It was likely not a single procedure with a single purpose. In some cultures, trepanation may have been performed to release evil spirits or demons believed to be trapped within the head. This suggests a connection to spiritual or religious beliefs. Traumatic head injuries, such as skull fractures, may have been another common reason for trepanation. The procedure could have been used to relieve pressure on the brain. Some researchers believe that trepanation was also used to treat a variety of ailments, including headaches, epilepsy, and mental disorders. This highlights the early attempts to understand and treat neurological conditions. Performing trepanation required a high degree of skill and knowledge. Ancient surgeons had to navigate the complex anatomy of the skull and brain with limited tools and no anesthesia. Several different techniques were used for trepanation, including scraping, cutting, and drilling. Each method had its own advantages and disadvantages. The scraping technique involved slowly removing layers of bone with a sharp instrument. This was a time-consuming process, but it minimized the risk of damaging the underlying brain tissue. The cutting technique involved using a sharp blade to create a circular or rectangular opening in the skull. This method was faster than scraping, but it required greater precision. Trepanation may seem like a barbaric practice to modern eyes, but it represents an important step in the development of surgery. It demonstrates the early human attempts to understand and treat the human body. The knowledge gained from trepanation likely contributed to the development of more sophisticated surgical techniques. It paved the way for the neurosurgery we know today. By studying trepanation, we can gain a deeper appreciation for the challenges faced by our ancestors and the ingenuity they displayed in the face of adversity. It is a reminder of the long and complex history of medicine. Trepanation also raises ethical questions about the limits of medical intervention and the importance of patient consent. These questions remain relevant today. Trepanation is more than just a historical curiosity. It is a window into the past, offering insights into the beliefs, practices, and skills of our ancestors. By studying trepanation, we can gain a deeper understanding of the human condition and the enduring quest for healing. It is a story of courage, innovation, and the enduring power of the human spirit. The legacy of trepanation lives on in modern neurosurgery, reminding us of the long and complex journey of medical progress. It is a testament to the enduring human desire to understand and heal the human body.